with the advent of technology and with the advent of advancements in the healthcare industry,
Right.
we can actually diagnose many more diseases at a faster rate and very rapidly at a low economic cost,
Right.
and which is easily available everywhere. So what happens is when people prescribe for these tests, when a wide number of tests are taken, minor variations can appear in the tests,
Okay.
and that will create unnecessary anxiety in the patient,
Right.
and it can create unnecessary trouble, and then they might get tensed, and then they might go for unnecessary further testing,
Right.
which is not required.
Right. If a person is completely healthy, no issues at all, can you suggest like 4 or 5 must-have tests? Like if you have don't have any problem, but you still need to get these tests, and these are not creating any hype, but these are must to have. So out of the full package, there may be some tests which are just for increasing the bill. Actually, these are just marketing strategy in full gold tests. So do you know some of the tests like these are actually not required, but are most of the time included in the complete package?
There are many variables which actually play a very important role when you get a test done. Like if you're having excessive exercise.
Yeah.
So excessive exercise can also vary your result. In terms of, for example, your creatinine kinase levels might be increased following excessive exercise.
You know, sometimes people tell like I'm on fasting, but just drank a tea or just drank a coffee. So what do you think? Like these are considered under fasting, or it's just the the intake of food actually?
When you take clear liquids, clear liquids are okay. If you're taking clear liquids like water or some squash or something, that is okay. But tea or coffee with sugar, it can still vary a little.
If by any chance a person is getting used a infected needle in his sampling process, so what happens then next? Because is it a complete disaster, or any processes there that can be done and the things would be aligned? When we just get the reports for our samples that we have given, like if we just see in the report, like there are some ranges, if some values may be little above side, some values may be little downside, but when we just go to doctor and we just show them reports, most of the time this happens, like doctor said it's fine, but we just remain curious, like no, the values are above that range, so why the doctor is still saying that it's fine? So hello everyone. In today's topic, like I'm not going to discuss about any disease, maybe it's heart related or any gut related, but today's conversation is going to be literally different because it's the basically diagnostic point of view, like what happens in our body, and if we have any problem, the first step that we do in our life is just go to the doctor, and doctor just suggest us to get our blood test done, so that they can actually know what's happening inside the body or not. So it's like in India, so many misconceptions are there related to blood reports and everything, and so many people don't even know like what happens actually when we give our samples to the doctor, how long these can be preserved, like what things we can consider in our mind while giving the samples. So we'll discuss each and everything, and whatever would be the doubts in your mind, I'm damn sure that these would be covered with this one conversation. So but before moving forward, I would just like Dr. Raj to give her little introduction, like what is her educational qualification, from how long she is in the same field. So I would request to Dr. Raj to please give a little introduction about you.
Hi, I'm Dr. Rajalakshmi, and I did my bachelor's, that is MBBS, from Ramaya Medical College, Bangalore.
Great.
And I did my master's, MD in Pathology, from Bangalore Medical College.
Right.
And after that, I recently moved to New Zealand, and so I'm preparing for my medical exams for registration and licensing here to practice, in order to practice in New Zealand.
Right. So great. It's just a vast experience. Like you can see that she has done her master's in the same field, like pathology. So I think she's the best person to provide all the details that we are going to start with the blood test and everything. So doctor, there is a thing that like what I observed these days in India, like when we used to be children, so blood tests were very unique thing, like these were not very common. Like if we have any fever or some problem for more than 5 days, 6 days, then doctor just suggests us like you should get your blood test done, and if any typhoid is there or something like that. But these days we just hear like regular routine blood checkups, everything. So how do you think about that? Is it really important?
Firstly, doctors may recommend blood tests according to the age or the gender or any risk factors or any family or hereditary history which the patient will have. So according to that, the doctors may prescribe any tests required, and moreover, we would have observed that previously, many years back, they wouldn't recommend tests as often as how they recommend nowadays. Partly, I believe it is because now, with the advent of technology and with the advent of advancements in the healthcare industry,
Right.
we can actually diagnose many more diseases at a faster rate and very rapidly at a low economic cost,
Right.
and which is easily available everywhere. So that is one of the reasons why nowadays, if we are having a doubt on some particular disease, we can actually prescribe a particular test and then look whether the test is positive or negative in a particular patient. Second thing is, prior they were solely focused on the clinical examination on the patient.
Right.
Right now we have access to so many tests which can additionally prove what our diagnosis could be. So I feel like that is a added bonus and an added advantage, that we are
Right.
able to do tests and then confirm our diagnosis. And moreover, nowadays the tests also help in the prognosis and the treatment of the patient. So we can actually, in certain diseases, we can actually get to know the levels of antibodies available or the levels of antigen
Right.
present in the body, so that we can actually prescribe appropriate treatment to the patient.
Exactly.
So I believe this is it has been like added as a bonus in our healthcare management system.
Right. Well said. So one more thing, like when we talk about like regular checkups, so there may be a thing like if a person is having diabetes, so regular checkup is required for that, so that if any changes is happen in the body, we can know. But another thing is like complete body checkup, like full body checkups package and all. So I just felt like these days these are also getting so viral, like most of the people having no issues at all, they are just telling that I'm getting full body checkup. So what you feel like, is it really necessary to get it full body checkup done, or if we have any problems, or we can just check some of those things which we can feel like have some symptoms or something like that?
Yeah. So nowadays, yeah, the trend is like even the hospitals or any healthcare management team will provide a health package where you get many tests, which include a wide variety of tests which are
Right.
there, which is not completely necessary for every individual.
Right.
So doctors can prescribe any particular test if required,
Right.
to people who actually have chronic diseases like diabetes or hypertension,
Right.
or any other lipid disorders. So for such people, doctors may prescribe particular tests or vitamin deficiencies,
Right.
or anything like that. But generally these tests, what happens is, when people prescribe for these tests, when a wide number of tests are taken, minor variations can appear in the tests.
Okay.
And that will create unnecessary anxiety in the patient.
Right.
And it can create unnecessary trouble, and then they might get tensed, and then they might go for unnecessary further testing.
Right.
Which is not required.
Right.
So one thing to think about is that the normal ranges which are given in tests, they are just what is the normal levels in a healthy population, in an average healthy
Right.
population of that particular age and that particular gender. So that normal ranges may vary.
Right.
And one more thing is, like, the testing conditions also are very important.
Right.
So the people might not have taken the test at that particular testing condition which is required by the test.
Right.
So all these conditions are varying and will also give varied results. So this can create unnecessary anxiety in a patient.
Right.
And unnecessary, people get tensed and then they go for additional testing, which is not required. So if you want, you can actually go for testing probably like once a year.
Right.
Or a little longer than that, with a longer frequency. And people who actually have either any deficiency, or people who are prone to any infections, or when people have chronic disorders like diabetes and certain lipid disorders or familial disorders,
Right.
doctors will ask for particular tests which are required for them,
Got you.
which will be at a lower frequency, which will be very at a lower frequency, like within 2 months or within 3 months. Every 3 months they will be asked for tests.
Correct. So what I just realized from what you just explained, like all the tests are not necessary. Very frequently testing is not necessary. So if I would just tell you one thing, like if a person is completely healthy, no issues at all, can you suggest like 4 or 5 must have tests, like if you have any, no, don't have any problem, but you still need to get these tests, and these are not creating any hype, but these are must to have. So what are these 4 or 5 tests that people should also think like these should be done in any of the scenario?
Particular, there are few tests which I recommend getting it done.
Yeah.
Not very regularly, but it's better to keep in
Okay.
check. So one thing would be the complete blood
Okay.
count, which will give you about the red blood cells,
Right.
the white blood cells, and the platelets. And it will also indicate whether there are any infections or any hematological disorders or any other inflammation. So this
Correct.
is one thing which I recommend getting it done, and it will also give you any further evidence of anything which is present in the
Right.
bloodstream. Second thing would be the lipid disorders for people who are the lipid profile, which is called as
Okay.
lipid profile, which is usually done for people who are having a cardiovascular risk
Got you.
or who are having a familial disorder.
Yeah, basically,
So those people will
cholesterol related
check
issues
on
should
that.
also be discussed.
Yes.
Right.
Yeah.
Okay.
So that lipid profile, and one more thing to keep in mind would be the liver function test, the
Okay.
renal function test. So these two function tests are it is better to get it done and to check whether they are at a normal range.
Right. So these were the tests that are must to be done. So out of the full package, there may be some tests which are just for increasing the bill. Actually, these are just marketing strategy in full body tests. So do you know some of the tests like these are actually not required, but are most of the time included in the complete package? Are there any tests, or you can think like no, all the tests are necessary?
To the best of my knowledge, all the tests are necessary
Okay.
in a patient in whom these tests are necessary. So the package is done so that it can include everything and it can benefit the people who are taking
Right.
the test. But these packages are not necessary for every individual who are there.
Okay.
So it is better to go to your doctor and ask them what they recommend, because they will give you a set of tests which are personalized for that particular individual
Got you.
according to their age, their gender, and their lifestyle, their risk factors, and what their family history
Right.
or their personal history. So depending on all that, the doctor can give you a personalized set of tests which you would be required to take.
Right.
So apart from that, I don't think any test is unnecessary, or it is the thing is you have to take everything with a pinch of salt. So
Yeah,
you
right.
have to take everything when it is necessary.
Right. So this is completely fine. But while we go to give our blood samples, like we usually hear like some tests are to be done during fasting, some tests can be done without any fasting, and you can have any food or something like that. So I just want to know like basically some tests like diabetes and something, I know 1 or 2 tests like it can be done with fasting only, but is there any category of test like if we are getting this body organ is tested, so this cannot be tested with having food? So is there any category, or some tests are just on the basis of that? Just for the understanding, like we should basically in ourselves should know like now this cannot be done without testing.
Yeah, so there are certain tests which require fasting.
Yeah.
So one a good example would be the fasting blood sugar levels.
Okay.
So fasting blood sugar levels requires you to fast
Right.
for about 10 to 11 hours or 12 hours, and there are the lipid profile
Okay.
tests which require fasting. So these require fasting. Apart from that, the random blood sugar does not require fasting.
Okay.
So usually it is better to ask the particular laboratory who is actually collecting your sample for the test for proper appropriate indication and proper appropriate
Right.
guidelines. So that they will tell you you are supposed to fast for these particular tests, and you don't have to fast for these particular tests. So mainly the fasting blood sugar levels require fasting, and the lipid profile will require fasting.
Okay, so anything like KFT, LFT, renal function test, these can be done without fasting?
Yeah, so these can be done without fasting.
Okay.
But one more variable is, like, one more thing you should remember is there are many variables which actually play a very important role
Okay.
when you get a test done. So we will think that, okay, fasting is one thing to keep in mind.
Yeah.
But apart from fasting, there are many other factors which influence the particular test result. So one thing would be if you are excessive, like if you are having excessive exercise.
Yeah.
So excessive exercise can also vary your result.
Okay.
In terms of, for example, your creatinine kinase levels might be increased.
Right.
Following excessive exercise. And so you should always make sure that you are informing this to the particular doctor who is
Right.
overlooking your results. So it is very important that you inform them that this particular thing is happening, because these are physiological variations which happen
Right.
in our body. And one more thing is sleep deprivation.
Okay.
And stress can also affect your cortisol levels.
Okay.
So if you're undergoing a cortisol level check, and if you're sleep deprived or if you're stressed, there are major chances that there will be variations in the results of these. And one more thing would be there are different variations which happen. So you should make sure that you tell, or if you are taking any vitamins or any supplements or any medications, so it is your duty as people who take tests to inform your doctor that you are taking these particular tests, because they can greatly vary your results.
And sometimes people tell, like, I'm on fasting but just drank a tea or just drank a coffee. So what do you think, like, these are considered under fasting, or it's just the the intake of food actually? So tea or coffee is considered as fasting or not?
So when you take clear liquids, clear liquids are okay. If you're taking clear liquids like water or some squash or something, that is okay. But tea or coffee with sugar, it can still vary a little. But if you are feeling really, fasting might not be easy for everyone. So you might be feeling a little uneasy or anything like that. You can always take something, but make sure it has no sugar in it, and then make sure that you are informing it to your doctor. So apart from that, make sure that you are fasting regularly, and try to stick to clear fluids like water or squash.
Okay, got you. And one more thing, like when people get their self testing, sometimes happen like we gave sample today to one lab, and tomorrow another result is required, and we get it tested from the another lab. So we can see, like, in just a change of one day, huge differences in the results are there. So what you think, like, is there any difference in testing mechanism, or what is the case, like the results completely vary, or it's just the representation of the reports?
So there are many factors which influence. First thing could be that the time at which you give your blood sample.
Okay.
So if you are giving the blood sample at the same time both the places, then okay. Otherwise, even the time at which you give the blood samples, again your results vary. For example, your iron levels, or your cortisol levels, all these enzymes and hormones vary during the day.
Okay.
So according to that also there will be a variation. Second thing is that each lab will have their own set of accreditation and their own set of internal quality control which happens.
Right.
So each analyzer will have its own normal values and its own set of high values, its own set of low values,
Right.
based on its calibration. So each analyzer will be calibrated according to their set of standardized reagents and their set of standardized protocols. So
Right.
every analyzer will have its own standard operating procedure, and they have their own calibration systems. So according to that, each lab will have their own values based on their analyzer.
Right.
So there are certain variations bound to happen if you're giving to two different labs.
Okay.
And the third thing would be that the before the sample reaches the lab itself, there are so many variables which happen, like we call the pre-analytical variables.
Right.
Whether it was at the right temperature, whether it was conditioning, whether it was carried along in the same conditions as the previous
Yeah.
one. So all the pre-analytical variables also play a major role. So that is also one factor which influences this. So there are many factors which influence when you give the same sample to two different labs.
Okay. So as you just mentioned, like the test get it done and the sample collection is there can be time gap. So does that time gap actually makes the things different? Like for example, if I gave my sample today morning 9 a.m. but some of the labs do not get the testing done by their own, but they just collect the samples and then in afternoon they just give it to a proper certified lab and just get it done. So for how long does the samples get really usable, and at is there any number of hours that after which if the testing would be done then the samples would be literally not recognizable actually the real condition?
Yeah, so each test has its own time taken. So each, we call it the TAT or the turnaround
Yeah.
time. So each sample taken for each test will have its own turnaround
Okay.
time within which the sample has to be collected, it has to be processed,
Right.
and it has to be certified and the results to be given out. So, for example, these time varies
Okay.
depending on different. So, for example, for enzymes and hormones, when you give the sample and when the sample stays at room temperature
Right.
for a longer time, the enzymes and hormones slowly they degrade.
Okay.
Okay, so what happens is the levels may vary as the time passes. The levels
Right,
may vary.
right.
So that is why it is important to maintain a temperature. So usually they make sure that if the sample is collected at a different place and if it is processed at a different place, they make sure that the sample is taken at the appropriate temperature maintained, and so
Okay.
that the enzymes or hormones are metabolically active. And the second thing is for the complete blood count, for example, it has a given time of 6 hours.
Okay.
So within 6 hours, it is preferable that the sample is within the sample collection, the sample, it is best for the sample to be run
Right.
and processed within that time.
Right.
And the second thing would be, like, for example, the coagulation parameters like prothrombin time and thrombin time and those things. The time taken would be about 4 hours.
Right.
So within 4 hours, it is best that within 4 hours the sample to be analyzed within collection.
Right. And one more thing, like we usually hear from people, like the test should be done from a certified lab or small clinics are not so dependable. So, what actually makes difference in these two things? Like, is it the machinery or is it just the knowledge of the people doing that? So, what actually makes difference? Like, it actually happens. Like sometimes the reports of small labs are not that much dependable and we have to get it done again from the proper certified labs.
So what happens is, in certain labs there is something called the accreditation, national accreditation.
Right.
For laboratories. So it is called the NABL,
Okay.
which is there. Like for hospitals, we have NABH, national accreditation for hospitals. So similarly, we have national accreditation for labs.
Okay.
So this varies depending on different countries. So in India, we have NABL. So what happens is, every lab which is registered to the NABL will have a standardized set of ranges, normal ranges,
Right.
and standardized set of how the analyzer analyzes.
Right.
So what happens is, we have something called the internal quality control which happens.
Right.
So what happens is, every morning and every few hours in the day, there are a set of reagents which we use, or the samples,
Right.
quality control samples, which we run in the analyzer to make sure that the analyzer is giving us the accurate value.
Okay.
Whether it is giving the normal value as normal, whether it is giving the high value as high, and whether it is giving the low value as low.
Okay.
So this is something which happens at every laboratory. It is called the internal quality control. Similarly, we also have something called external quality control, which is also called as the external quality control assurance programs.
Right.
So what happens is all the labs which are participating in this EQAS or the external quality assurance,
Yeah.
what happens is they are all given similar set of samples,
Right.
and they are all told to run these samples and to give the results of these samples.
Right.
So that way you analyze what each lab is providing, and you can analyze and you can see whether they are all giving accurate values, and if the values are precise enough or close enough in the similar range.
Right.
And then if they are not, whatever calibration has to take place or whatever correction has to take place will be done.
Okay.
So any laboratory which has the national accreditation will undergo all these processes, and it is very reliable. So
Okay.
it is better to go to a lab which has the accreditation, which will be more reliable and which will be standardized to many labs.
Right, right. So basically, we need not to judge by the place or the size of the lab. It's just the accreditation. If that lab is having the accreditation, it is
Yes.
100% safe, and the results would definitely be dependable. Yeah, that's nice.
Yeah.
One more thing, like it used to be my personal doubt from so long. Like we hear like the needles that are used for getting the samples are changed for every individual. And what happens if by any chance a person is getting used a infected needle in his sampling process? So what happens then next? Because is it a complete disaster, or any processes there that can be done and the things would be aligned?
So the chances of this happening is like null to zero, I would
Okay.
say, for a patient, because obviously everyone follows a sterilized protocol, but this usually the needle prick injuries usually occur to healthcare workers, because when they tend to take care of multiple individuals, or by some way
Yeah.
there are chances that the healthcare workers are prone to these needle stick injuries. So when such an injury has occurred, it is very important to go and notify the particular hospital and particular
Right.
governance system which they have in that hospital. And so there are certain tests which are conducted on this patient and on the healthcare worker.
Okay,
in
both
whom it has
sides.
occurred.
Okay.
So both their tests, so both their tests are taken. So certain retropositive tests and certain other tests, infectious screening and infectious tests are taken in both these individuals, and a sample from the healthcare worker is taken and
Okay.
tested for the particular test. And then there is something called the post exposure prophylaxis. So after the needle injury, a prophylactic regimen or a prophylactic medication is given to the healthcare worker as well.
Okay.
So that if there are anything to keep everything in check, a prophylaxis is given until her results turn out to be her results come. So until his or her results come, that particular healthcare worker will be under prophylaxis, and once their results come and everything is okay, then they will slowly be taken off the medication, and even the patient's blood tests will be taken, and so their results also will be checked.
Okay, so it means like medical professionals who are undergoing these all things are actually completely safe if sometimes it is happened. So is there any time limit, like within this time period, if it is done then it's fine, otherwise the things cannot be done after that, or it can be done anytime?
So it is very preferable that the patient and the healthcare worker give their sample immediately.
Right.
Immediately within 4 to 6 hours.
Okay.
So within 4 to 6 hours, both their samples to be taken, so that we can actually get to know. And periodically, the healthcare worker samples will be taken to look for antibody levels and to look for any
Right.
other infectious screening to be done. So that will be done, but preferably as early as possible.
Okay, right. And one more thing, like when we just get the reports for our samples that we have given, like if we just see in the report, like there are some ranges. If some values may be little above side, some values may be little downside. But when we just go to doctor and we just show them reports, most of the time this happens, like doctor said, it's fine. but we just remain curious, like, no, the values are above that range, so why the doctor is still saying that it's fine? So what actually is that denotes, like, maybe those ranges that are mentioned are still having any chances of above and below variation that are completely in the normal range, or what it is?
Yeah. So what happens is minor variations will occur, and the doctor might say that this is okay for you.
Yeah.
The chances are this happens because the normal ranges which are actually given by the laboratory or by
Yeah.
the nationalized the organizations. What happens is these ranges are the normal ranges in a population of healthy individuals.
Okay.
And so majority of population might have the normal ranges, but there are small set of people in whom the ranges can vary a
Okay.
little here and there, and then that is why we always say that the blood tests are data, but to analyze the real power
Yeah.
is to analyze the data according to the patient's clinical condition. So as doctors, we look at the patient as a whole and the patient's clinical picture. And so if they are having any symptoms, or if they are having any history, or according to their lifestyle factors or their age and gender, we come to a conclusion that this particular range is also normal for this particular individual, or there are no other significant abnormalities in this particular individual. So it is always important to see the patient's clinical condition as a whole rather than one
Okay.
single test being abnormal.
Okay, got you. So basically, it's also depends. Like, doctors knows everything about us, and that's the reason he by himself just get the all maybe analysis and everything, and then he just tells out like it's fine or not. So it can, is it possible that if the values are fine, but still issues can be there in the specific that test only, just because of our own history and everything?
So that occurs very rarely, but there are chances that a particular individual might give normal
Yeah.
results, but it does not mean that entirely everything might be everything is
Yeah.
fine. Sometimes some hidden conditions, or either the patient is at a stage where the clinical condition has not yet set in,
Okay.
or the symptoms have not yet set in, but the disease process is evolving.
Yeah.
In such conditions, rarely the test can turn out to be normal, because the disease process has not yet evolved to reflect on the blood levels.
Okay.
So that is one place. Or sometimes the blood results might turn out to be normal, or radiologically or histopathologically some issue, some diagnosis can turn out to be there, or
Okay.
when the blood results are normal. These are also possible, but very rare scenarios which happen like that.
Okay, okay. So these were the most popular and most common questions, not only from other people point of view, from my point of view as well. But right now, I'll just asking you rapid fire round in which you'll answer by yes or no, or you can just give little explanation as well. So, firstly, like, fasting is required before every blood test.
No.
Okay. Test is
Only fasting blood sugar and lipid.
okay, great. Test results can vary lab to lab.
Yes.
Okay. Does weakness happens after giving blood samples?
No.
No. Okay.
Generally, no.
Okay.
Yeah.
So this is a misconception. Most people like, I give the sample, now I'm feeling weak. So that was a question from my perspective as well. More test is equals to more health awareness.
Yes and no. Generally, tests are done just to rule out any
Yeah.
diseases, and not diagnosing more
Right,
diseases.
right.
Blood tests are usually done to rule out
Right.
diseases.
One abnormal value is equals to serious issue.
No.
Okay. Can a healthy person has bad report?
Yes, very rarely.
Yeah. So I think most of the questions were done, and this rapid fire round also gave more clarity, because if someone has not seen the complete podcast, so at least these were the major takeaways from the whole podcast. So if a person is watching this, I'll make it as a short video. So definitely it can also help the people with the brief understanding a 30-minute podcast in just 1 or 2 minutes. So I think that would also help. So I would just like to thank you a lot for your giving your time.